What's up, everybody? I know you guys are wondering, where have you been? We have not gotten an update about your juicing. Well, guys, it has not been working for me. It's been about, well, I'll just say that I was juicing for about 2 months. And as you guys know, after like the first week, after like the first week, he's trying to say hi. Say hey. Say hey. Yeah, so after like the first week, I was like, you know what? I cannot just juice. Like, I have to have something to chew and, all of that stuff. So, I started incorporating salads and soups and, things that were low in calories, and carbs. So, I was taking in about 700 calories a day. And I started at 305, I believe, with the juicing. And then after 2 months, I got down to 302. So it was like, it just wasn't working for me. So I went to my doctor and I talked to her about my issues about, I've been exercising, I was dieting, I've done juicing, I've done fasting, I have, done all of that, and I cannot seem to lose the weight. So I asked her about Belviq. You guys know about Belviq. It's been on the commercials for a while now. And she was like, no, I'm not putting you on Belviq. It's new. It came out in 2012. It just has too many side effects. It comes with mental instability, suicidal thoughts, on top of some other on top of some other health issues. So she was like, no, we're not going to do the Belviq. So I was like, well, what is it that I can get on that can help me with this weight? She's like, well, there's no magic pill that's going to help you lose the weight, And I was like, it's got to be something that can help me because I'm on this insulin. The insulin that I'm on is called Humulin. It's Humulin 70/30. I said this insulin has steroids in it. It's causing me to beef up, bulk up, gain this weight, and it's got to be something to counteract this, and I'm a diabetic, so of course, you guys always say you need to lose weight, you need to get your weight in check. Well, I need a little help with that. Hold on, I'm sorry. Okay, sorry. So she said, okay, no Belviq. There's another new drug that I've recently heard about. And she was like, no to that. And I was like, well, what is it that I can take? So, in a nutshell, she prescribed me Phentermine. It's Phentermine. And it's 37.5 milligrams. And you take it once a day. Okay? And you can only get it by prescription. So this is the pill. Okay, I don't know if you guys can see that. Okay, it's white with blue specks on it. Okay, so that's the pill, and you take one of those a day. And I've been taking it for 2 days now. So let me just say that. I've been taking it for 2 days and I feel great, okay? I won't know my weight loss results until probably Monday when I'm able to get to the scale. So when I started the pill, I was at 304. So yeah, it's been an up and down thing with the weight. So hopefully this will help. She did tell me that I would only be able to take it 3 months. For 3 months, and that's it. I could not take it for longer than 3 months. She also said that she would prescribe me on a month-to-month basis. So after this first month is up, or close to when this first month is up, I need to go get my blood pressure checked. and I would have to get my weight checked. And she will determine if, you know, she thinks I should continue with the medicine for the next month until 3 months are up, pretty much. Okay, so my doctor gave me this right here. And I'm pretty much going to go through this with you guys. And it's basically just information about how to use it, some side effects and things like that. So yeah, some other common brand names for this is called Adipex P, Lonaman, and Profast. Okay. I'm so sorry. Biting on the paper. Okay. So, Phentermine is used along with a doctor-approved reduced calorie diet, exercise, and behavior change program to help you lose weight. It is used in people who are significantly overweight or obese and have not been able to lose enough weight with diet and exercise alone. Let's see. It is not known how this medication helps people to lose weight. I'm trying to skim through it so that I'm not, you know, taking forever to read it. So yeah, it says it is not known how this medication helps people to lose weight. It may work by decreasing your appetite, increasing the amount of energy used by your body, or by affecting certain parts of the brain. Okay, so yeah, you take this medicine by mouth once a day. It says 1 hour before breakfast or 1 to 2 hours after breakfast. Let's see. Taking this medicine late in the day may cause trouble sleeping, insomnia. So let me see. Swallow the medication whole. Do not crush or chew it. Let's see. If you are using the tablets, which is what I'm using, made to dissolve in the mouth, I don't think that's what I'm using. The dose is usually taken once in the morning with or without food. So it goes on to tell you how you're supposed to use it, but basically just once a day, depending on, you know, what you have, either the one that dissolves in your mouth or the one that you just, you know, swallow with some water or something. But either way, you just take it once a day. The dosage is based on your medical condition and response to therapy. And your doctor will adjust the dose to find out which will best benefit you. Let's see. It says this medication is usually taken for only a few weeks at a time. Let's see. It should not be taken with other appetite suppressants. Let's see. The possibility of serious side effects increases with longer use of this medication. Let's see. Use of the drug along with certain other diet drugs may cause other side effects. This medication may cause withdrawal reactions, especially if it has been used regularly for a long time or in high doses. In such cases, withdrawal symptoms such as depression, severe tiredness may occur if you suddenly stop using the medication. So your doctor may reduce your dosage gradually. Do not increase your dose. Take it more frequently or use it for a longer time than prescribed. Okay, so let's move on to side effects. Side effects include dizziness, dry mouth, difficulty sleeping, irritability, nausea, vomiting, diarrhea, or constipation. If these persist or worsen, notify your doctor or pharmacy. Okay, let's see what else. Many people using this medication do not have serious side effects, so tell your doctor if you have any of these unlikely but serious side effects, such as fast, irregular pounding heartbeat, mental mood changes such as agitation or uncontrolled anger or hallucinations or nervousness, uncontrolled muscle movements, change in sexual ability or interest, Stop taking this medication and seek immediate medical attention if any of these rare but serious side effects occur, such as severe headache, slurred speech, seizure, weakness on one side of the body, vision changes such as blurry vision. It says this drug may infrequently cause serious, sometimes fatal, lung or heart problems, such as pulmonary hypertension or heart valve problems. And the risk increases with longer use of the medication or when you use it with other appetite suppressants, which it says you should not do. Let's see, if you notice any chest pain, difficulty breathing with exercise, decreased ability to exercise, failing, swelling of the leg, ankles, and feet, or any type of allergic reaction, of course, you need to call your doctor and stop taking the medicine. So yeah. Some of the, we're going to look at some of the precautions now. I know this video is running pretty long. It's 11 minutes now. So I'm going to try to hurry up with this. Before taking this medication, tell your doctor or pharmacy if you are allergic to decongestants, such as pseudoephedrine, stimulants such as amphetamines, or appetite suppressants such as dithopropion. It's a long word. I had to figure it out. Or if you have any other allergies. Let's see. This medication should not be used if you have certain medical conditions. If you have uncontrolled high blood pressure, glaucoma, history of alcohol or drug abuse, vascular heart disease such as chest pain, heart attacks, mental mood problems such as severe anxiety or bipolar disorder or psychosis or schizophrenia, high blood pressure in the lungs, stroke, overactive thyroid. You need to tell your doctor about all of these things, especially if you have diabetes, uncontrolled high blood pressure, or other heart problems, kidney disease, and seizure problems. So if you have any of those, you need to talk to your doctor about this. This drug may make you dizzy or rarely drowsy or cause blurred vision. Do not drive, use machinery, or do any activity that requires alertness or clear vision until you are sure you can perform such activities safely. Avoid alcoholic beverages. If you have diabetes, check your blood sugar levels regularly. Let's see. Before you have surgery or go to the dentist, you need to tell your doctor, your dentist, or your surgeon that you are on this medication. Let's see. This medication is removed by the kidneys. So if you have kidney problems, you need to talk to your doctor to see if this is for you. This medication must not be used during pregnancy. It may harm an unborn baby. If you are pregnant or think you may be pregnant, tell your doctor immediately. This drug may pass into breast milk and could have undesirable effects on a nursing infant. Therefore, breastfeeding is not recommended while using this drug. Okay, so yeah, there are other little things in here talking about overdosing, missed dosage, and how to store it, and drug interactions with other things, but I'm not going to go through all of that. I just want you guys to kind of know some of the side effects and some of the things that you need to consider before talking to your doctor about it. Now, just to let you guys know, every situation is different. I'm a type 2 diabetic, but I'm on insulin. I tested positive for protein in my urine, which is a possible sign of kidney damage or early signs of kidney damage. And so to prevent that, my doctor put me on lisinopril, okay, to help with that. And it's actually like a high blood pressure medicine. Even though I don't have high blood pressure, that medicine can also help protect your kidneys. So when it talks about the kidney damage and, you know, things like that it may cause, well, I'm already on a medicine that kind of, you know, counteracts that. What else did it talk about? Having mental issues. So let me see, I would say about 7 months ago, and really all through my life, I've dealt with bipolarism. But it wasn't until about 7 months ago that I actually talked to a doctor about it and was prescribed some medicine. I stayed on the medicine for about 3 weeks, and then I took myself off because I felt like, even though it's a hormonal imbalance in your brain, a chemical imbalance in your brain rather, I felt like it was my circumstances, the things that I was going through in my life that was causing me to be so miserable and so depressed. And I told myself I need to change my outlook, change my perspective. I need to pray more. So, and I also felt like the pill was a placebo because there were days that I didn't take it and I felt the same way on the days that I did take it. So with that being said, I was just like, I don't need this medicine. So I got off of it. So, but like I said, everyone is different. So I've dealt with that. So moving on, I've taken this medicine for 2 days now. Yesterday was the first day I took it, and about an hour after taking it, I just felt energized. Like I was ready to get out, do stuff. I wanted to go running. You know, of course, I don't like to run. So, it was like shocking for me to feel like, hey, I feel like running. Like I really wanted to just get out and just go. I had so much energy. I felt good. I felt, just happy, and, it felt great, and I didn't feel like a hard crash and burn type of thing, later on in the day. I felt normal, it had been a long day. I was tired. I was ready to go to bed, and I was able to go to sleep. So I didn't feel, the insomnia or feeling like I couldn't sleep. So that was one thing that I noticed. Today is the second day that I've taken it. And again, I just feel energized. I actually got out. It was cold, got out, ran some errands, and I feel great. I have not been hungry. Now, as a diabetic, it's important that, as diabetics that you eat, especially if you're on medication like insulin or what's called glipizide or things like that. You need to eat at least once every 3 to 4 hours. But when you're on this medicine, you forget to eat. Before I took the medicine, I think I woke up and I had like a bowl of cereal and some water. And I didn't eat anything else. I didn't think to eat anything else. Like, I just wasn't thinking about it. And I didn't feel hungry, like, at all. So when my sugar dropped, it was no surprise that my sugar dropped, and I needed to, quickly get something in my system to get it back to a normal state. But I really just was hungry. Nothing appealed to me. Like, I passed by Chick-fil-A, Panda Express, Taco Bell, McDonald's, everything that, you can just say, I'm going to give me some of that today. Yes, I want some of that today. I didn't feel none of that. So I'm running about 18 minutes. So I'm going to wrap this up. If you need a jump start in your weight loss, because my doctor said that the patients that she's prescribed this medicine for, they've lost the average between 30 to 35 pounds in 3 months. So, it may take some time, but I figured, hey, a little progress is better than no progress. For a while, which is one of the main reasons why I wanted to start juicing, was to at least get out of the 300 range, get down to 2 something. So if this medicine can help me get out of the 300s and down closer to my goal, then I'm all good for that, And I'll consider everything that, the side effects, the risk, and all of that stuff. And I feel like, I'm already on medications that kind of counteract all the other stuff, that's going on. And the other thing that I know is that sometimes with medicines, when they do studies on people, they have to write down every little side effect that the person may feel. So let's say you're a normal person, you're going to go try this medicine out for science, and for whatever reason you got a headache, and you report, well, I got a headache. It might not have nothing to do with the medicine, but you know what? They have to report that you got a headache. So they're going to put in their side effects could possibly cause a headache. So, you have to kind of weigh your options and just kind of think about, is this right for you? Talk it over with your doctor and see if this medicine is right for you. I'm going to weigh myself on Monday, so I will be recording. I promise I'm going to record on Monday so that, you know, you guys, and so that I will know my progress. Okay. So I hope this helped you guys, and I'll see you guys really, really soon. Today is Friday, so yeah, I'll see you guys on Monday. I hope this helped. If you have any questions, leave it down below, any comments or anything like that, and I will answer you because I had questions too, so, you know, but I got you. So just leave it down below, and I'll see you guys soon. All right, bye.